Alright, you are.
Okay, hello, everybody. Thanks for being here today. We're calling this meeting of the Advisory Council on Child Poverty and Strengthening Families together. Part of the charge for this council, we have 3 kind of regular meetings, and then it also requires that, we have one of these types of meetings where we're out off-site, away from the State House. I know as a legislator, it's very easy when you're in the State House to just get sucked into what's happening in the building. And we watch a lot of presentations. And so this really encourages us to get out and be in our communities and hear about the experiences from our communities and the people who live there. So this meeting is also a little different, much like the State House. We won't have lots of presentations. It's really just a discussion. So we have a series of questions, but I think our group size is enough that we can just have a discussion together about these questions. And reassess if that doesn't seem to be working. Can you hear us okay on Zoom? Wonderful. Okay, so our first question are, what do you think are the biggest challenges facing Vermonters in poverty today? If you want to write them down or just share out, I can take notes. You have a list and only want to share some. We have folks. Pass out some. One thing I can start us off. One of the biggest challenges that's also really hard to overcome that I'm seeing, and I know in my work outside the legislature, is like a despair and loss of hope, and that is a lot of people who've been told, here's this option, and then it falls through, and then another option, and after years and years of experiencing that, it's really hard to have that hope that something will change. And then from that, we see a lot of symptoms of that loss of hope that make it really hard for them to keep moving on day by day and staying in it. So that's just like a bigger theme that I've really seen. And I think that's a lot of it is to do with just the lack of resources to meet the need. There's just not enough right now. And so people are really losing hope that their life can change. We can give people a couple of minutes to think, and then just raise your hand if you want to share something.
Yeah, just thinking about you said, I'm thinking about along that losing hope over things that you don't have control over too. I think that's like you might feel like things are getting better and then you get your tax bill in the mail. That's going up 25% that you didn't budget for, right? Like and you don't have control over some of the things that are directly impacting your life. Or how you're used to living, or how you hope and being aspirational about raising your kids, and then you just can't do it.
Obviously, a huge one in this state is just like getting more particular is housing. I think not just for people in poverty, folks all over Vermont, regardless, even in upper income brackets. And I have a doctor's practice in my area who's struggling to fill a vacancy because they can't. None of the prospective doctors can find housing. So it's really we're in this true crisis around housing options, but of course people living in poverty, I think, feel that much at a much greater extent than the rest of the population.
I know that there's people in my community, that have trouble accessing resources while single parenting. And that's a huge disadvantage to them, that they can't get the places they need to be and work and care for their child, just to access the resources they need to be able to live and care for the child.
Their car in a timely manner, or make it to work, or make it to any of the many appointments that are required to maintain the services once you've accessed them, or access them in the first place. Yeah, I mean, I feel like accessing the services is a huge challenge, and like doing it on your own, doing it on your own is very difficult, and doing it with help requires you to go to where that help is, when that help's available. And that's just like time.
Everything is a choice. It's like, if you do this one thing, this is the thing you're not doing, and that's whether like paying bills or, you know, getting to places is like a constant. Not enough resources to meet the needs.
Being able to think far enough ahead, like,
Yeah.
think far enough ahead to apply for fuel assistance. Like, you gotta do that in like July. And then you don't think about it until December, and I don't know if it's gone now, but like it gets allocated out based on who applies. Time seems to be one of the biggest challenges.
Hear that all the time, and also like the blend of trying to balance work in a less flexible job and support kids in school. Where they need support, and also managing all of the appointments that you mentioned, it can be almost impossible.
It's kind of like a big four. And all of them get crunched in the same kind of ways, it's some kind of health emergency, health issue. And then that's gonna eat up all your time, even if you're unmedicated and you can access care, it's gonna take all your time, and then you get a job. And then you've got a lot of disability or unemployment, and how many months is that gonna happen? Did you still plan ahead and have an emergency fund to cover you for like that month or 2 months? I guess we could just do like a whole litany of how difficult it is to live in our society, but when you're dependent, when you don't have all the resources yourself, then you need to ask people for like everything, every time you have to ask, it's a challenge. So just like money, just like money deposited in your account would be really great.
There's a lack of clarity of what different resources are, and depending on like what you're trying to obtain, like. I've gone one place that seems to advertise that they are the resource for this problem, and actually they can't help me or my friend, so they send me to the other building. That says that they handle that resource, and it's just like. All over town or all over the state, and nobody's actually filling that resource anymore, and it's no longer available. That feels very dreary.
Well, does anyone on Zoom have any thoughts? Want to share what you're seeing in your work? Yeah, I can't read who raised their hands. Oh, there it is, yeah, I'm trying to read that little, the dot. Yeah, go for it. Oh, you're muted. Still muted. There you go.
Sorry. We had a low income advocacy meeting today, and it seemed that, in addition to the big things, that people still seem to be scrambling just to meet the basics, heating their home, and the big thing we talked about was the access to food, and people got more money during COVID, and that money is gone, and there's no state funding or federal funding for food shelves, and they're being used a lot more than they have been. And we just haven't kept up with accommodating that difference for people needing just basic stuff, heating their homes, and then accessing food. I mean, it's easy enough to go to the food shelf, but I know that they're struggling in terms of their ability to supply and buy the food and have it available and that type of thing. So that seems to be an ongoing increasing problem of late.
Sarita?
Um, well, housing, I think, is huge to me. I just feel like if people have a housing that is stable and secure, it's much easier to deal with some of the other issues that you're talking about. So I think housing is one of my our top priority. And also, I think one of the themes I'm hearing about is this transitional process. Like if you're homeless, not just putting someone in a new home, but providing these. I'm just hearing a lot about these transitional services, to help people navigate the bureaucracy to access resources. Because I'm hearing that is very difficult for people who have to work full time, take care of their children, and deal with just all the life issues that they have to deal with, and then have to navigate how to get to these resources. So that's a big one, and I've been hearing that since the beginning of our group meetings. That seems to be a theme in terms of how difficult it is to fill out forms or fill out applications or follow up on work that needs to be done in order to access resources. So that I'm hearing that across the spectrum in the conversations we're having.
I'm gonna call that programmatic red tape. Yeah, it's a lot to navigate. You have to navigate it for each system intertwined in your life, which makes it almost like another job. Okay, anyone else? If folks feel ready to move on to the next question? Yeah, okay. Yeah, oh,
And I think you brought it up, or you spoke a little bit about the car, like what happens when the car goes. I think transportation is a piece of this specifically that we see around here, as far as accessing resources, when transportation is not much harder to access as you don't have specifically your own. Get there, not when.
works for you.
Right.
Yeah.
I think anytime you get together with some people who are living low on the income scale, you can all bond over complaining about the public transportation.
What about mental health or just generally support for people with disabilities or people with a family member with a disability? And how difficult those services are to access and so underfunded, and particularly like the revolving door of like, you underpay people, then they don't stay in the job, and so then you have a different person and a different person and a different person, and that's hard to establish a real custody relationship.
Thanks, everybody.
You got here just in time. We can just go get started. We're on the first question. What do you think are the biggest challenges facing Vermonters in poverty today? We talked about transportation. We talked, just about the just absolute shortage of housing options for everyone. And a lot of themes just around how difficult it is to access resources in the first place and how they are just not enough. Thinking, and any area you look at, they're just not enough. But I don't know if you have any thoughts or specific things
Yeah,
you wanna add?
We're going through a needs assessment right now with partners, so we're hearing a lot of the same stuff, the kind of increasing gap between housing costs and wages, lack of services that are available to folks. And we're hearing that in every part of the state. Very consistent.
So now we'll move on to question 2, and that's, from your experience and perspective, what works well to help lift Vermonters out of poverty? I'd like to think if we're not thinking about how much it costs, what are things in your work or in your own life that have helped, that you think help, you see as something that can help lift Vermonters out of poverty?
I think one of the ideas was already mentioned.
Okay.
Yeah. Regular money.
Yes. Okay.
I think that also gets, one of the things I think about poverty a lot is we basically define poverty as an income. But poverty is more an experience than it is an income. And so once you, say we did just have an income, everybody got an income. And it was the poverty. Then we would start to see that poverty is really more of an experience, and that everybody's getting this income, but then people who have different challenges might still be experiencing poverty. Or people who didn't have those challenges, like any kind of legal issue or health issue or kids with needs, then you might start to see a separation between poverty as an income and poverty as an experience. And so that's one of the things that I struggle with a lot is people can have a very low income and not be experiencing any of and not experience any challenge with healthcare or transportation or housing or food or the law or mental health. You could not have any of those experiences and have a low income. So it's just the way things are set up that if you have a low income, you're most likely to be experiencing challenges in all those places. But I think you'd start to separate out the difference between just not having enough money and having way too many things that you have to take care of in your life.
Well, and what you said about being so hard to access, that if you have money and you have a legal problem, well, then you go hire a lawyer. And if you don't have money, you have to call legal aid and sit on hold and do an intake and go to an appointment, it's just a lot harder, right? I work for legal aid, so I'm not bad mouthing us in particular, but it's a lot more work.
And there's so much more worry, when you don't have advice and some understanding of how things could play out, then there's so much more worry, and that adds on to everything else.
I think our systems are so disjointed that you can't you do that one intake and then it, can get, shared out as much as possible. And there's been some work to make that better, but it's just, you've got to fill out all of the housing apps and then you've got to fill out and it's the same in 95% of the information. It's the same information that you're feeding into all of these places that have the resources you need. That really makes it a barrier.
I did notice though that a lot of the subsidized housing providers now have uniform housing applications.
Yes.
Yeah, so I mean, that seemed past few years, so I guess it's there's some low hanging fruit that that could make it a lot easier for people.
Your point, I feel like it's very stressful to be experiencing poverty, and so if you can let that piece out, it just helps create space to navigate all of those other systems that many people are navigating every day, right? But it just creates that capacity to work through those really difficult things that are gonna come up in everybody's life But when you layer poverty on top of that, I feel like it's really hard to balance all the pieces.
Any thoughts from Zoom? And I can repeat the question if anyone would like. Feel free to chime in.
No, I think just as a brief thought, I really like the sort of thought exercise of thinking about poverty as an experience instead of some sort of threshold that we draw up. Specifically because I think that, you know, one of the things that we've definitely heard in this group that I think that we've heard around the state and, you know, that we're hearing tonight is there is a universality of the challenges that people are facing, right? Housing is not an exclusive problem to individuals experiencing poverty, nor is childcare, nor is healthcare, nor any of these other pieces. And it's that universal design that maybe even asking this question is asking it in a slightly wrong way of what brings people out of poverty instead of, you know, what are the support systems that are effective at slowing or stopping people from moving from a place where they're not experiencing poverty to experiencing poverty. And if you have good design around those policy interventions, that will probably also stabilize people who are currently experiencing poverty. And so I think that's a very helpful way to think about the design of the interventions that the state might pursue.
Yeah, I really like that framing. Do you have any thoughts on potential?
I definitely think that anything we can do around housing, I really think some of the work that the United Way Northwest Vermont is doing with the Working Bridges program, those wraparound services, really going in and meeting with employees when they have, you know, when the employer is able to set that up to discuss navigating, you know, some of the challenges, whether it's financial or health or other, you know, and giving people who have to work through more red tape, who probably have less bandwidth to do that in the first place. I think that's a very effective program. And if there are ways to scale that, I think that would be an exciting path to look at.
I think from my own experience during the pandemic, when there was a lot unknown, having that federal aid was really helpful. It just created like a no guarantee that things would be okay and just provide space for families to meet their own needs. Make work choices or school choices that work for their families.
We're talking about the tax credit for, yes,
Expanded.
that were paid out regularly rather than that, you know, trying to hold on till yeah.
I think building on what he was saying too, we have a lot of programs in Vermont that kind of evidence has shown are highly effective, and they just don't have the resources like expanding pathways. In Rutland, Pathways is going to have an ask this legislative session to expand into Rutland and have resources for that. So identifying those kind of data-driven evidence-based programs and resourcing them, or we have in terms of like the reducing the likelihood of people like losing their housing, like, you know, the HOP program, and making sure that we're expanding the HOP program and all their funding. So we have a lot of things, just there's not the resources to make the system work.
Do you wanna just explain the HOP funding just a little bit in case anyone's not familiar with that?
Sure, I mean, so the OEO is giving out funding to like kind of folks within the homelessness response system to fund various positions that are kind of focused on keeping people from moving into homelessness. They also have direct cash, you know, capacity to help people with various needs. So it's like a whole list of things that they can help with to reduce the likelihood of people moving into homelessness.
Is that regionally based or is that?
So it's statewide, so they'll fund a lot of kind of providers at the local level that they provide across the state. So a lot of the folks within the local housing coalitions are getting HOP funds for like housing navigation staff, or I mean, you can.
All of our staff
Yeah.
are paid through the HOP funds for housing support.
In fact, right, is that one?
Yep.
And so there's like the issue every year where they're not providing the necessary funds, but also not providing the increases for like COLA that are necessary to kind of keep people in.
Right.
And I think another issue is the fact that so much of this is like year over year, and like, so it's not a year, like a manager to map out. Like, this is how we solve this, it's all one-time funding, so there
Yeah.
needs to be long-term
Trying to
investment.
build a budget when you
Yep.
don't even know how much you'll receive, yeah.
Sounds like more really, right, like it's for family benefit program, not having to be reliant on reauthorization, but having some.
Medicaid. They're like really important.
And universal meals.
Or just public education in general.
When like all of these things, and also something that worked really well in the pandemic, and I think it was because we were all, you know, kind of very much restricted to home, so we had more time to meet. But there was a lot more cross-coordinated kind of efforts happening. I just know in all of the meetings, during that time, we saw like a wider net of community partners coming together around different areas. And I think now that we're all back in person, where we all struggle to, I think the meetings still happen, they're just not as effective because all of the agencies are understaffed. And so people are trying to do that with a lot less time, and ability to really engage in those kind of, non-siloed partnerships. If you look at the, kind of the United Council, acronym, it's like the Federal Council kind of on ending homelessness. A lot of the recommendations, both the youth one and the just kind of general one, are really about building up those cross-system partnerships like healthcare and housing and all of those people, and really bringing people together to adequately be able to leverage money, but also staff time and people available and meet the needs. So I think we need to figure out a way to make that more possible for all of our organizations to do that work together.
If the goal is really to help lift people out of poverty, I think we need to get to a place where there is asset building and savings, so that those unknown or those expected crisis points aren't going to really send people back to a place of not being able to meet their needs. We have to get beyond the like scarcity of just meeting basic needs and get to a place where people have a reserve that they can use as needed.
Yeah, I think like in the pandemic, for a lot of programs, we did away with kind of resource tests around assets, and part of that was because people have more money coming in from the federal government, but it allowed people to save and build up. And when emergencies happened, they had money there to be able to meet the need. And I don't think little emergencies were as catastrophic as they can be now. I mean, you can blow a tire, and that's gonna take several months for someone to recover from, if not like a year, depending on what funding's available and whether they can access it. So I love that. I agree.
That's all good. Stop trying to convince people everything they should do is spend money.
I think that connects to something about the asset building too, is that you can't just like give people the framework to have savings, I think people need to be like, understand the empowerment of savings. And also like, I don't know if it's like psychological and emotional therapeutic coaching and help to understand, like, especially coming out of an impoverished situation, that you can live a satisfied life without spending the money that you have beyond your bills on things. And working towards the greater goal of being able to have the cushion when there is a next emergency, and that's like a huge leap to get past. For a lot of people, and especially people that deal with scarcity.
Yeah, I think that might go back to the hopeless, so to some degree, the hopelessness of it, like. When you don't really have a hope for a better future, it's easy to spend everything that you get a hand on, because you may never have it again. So you'll enjoy it while you have it. And it takes a while to get to the point where you understand that you have savings, you know how to save, and you will always be able to have savings again, like you gotta save up $10,000. Once you save up $10,000, that's pretty amazing. Like it can be done. And then you just do it again and again, and eventually you have real assets. You have wealth instead of poverty. But if you've never saved up that much, if you never even saved $1,000, then it just seems like that's impossible.
That makes me think of like generational poverty,
Yeah.
like the cycle of generational poverty and what you've been taught or what you've experienced. I thought a lot about it when you said poverty as an experience as well, just how we respectfully and non-judgmentally break through that barrier of generational poverty.
Any other thoughts about this? And, we can move on.
I have a question.
Yeah, go for it.
I didn't hear any of you guys mention relationships with social workers or health providers or people in general. Do you think other people can help other people out of poverty? Or it has to be you lift yourself up by yourself?
Yeah, that's a good question.
I don't think you can do it by yourself.
Yeah.
I mean, the model we have experience with is having an accountability partner. Somebody who will ask you what your goals are, how you want to do them, sit with you while you set them, and then check back in with you. And like, that's the way I've seen it happen. Or experienced it, so I don't know. I don't think you can do it by yourself. And I guess also to that point, like when you call somebody for help, it's almost always a different person. I guess I don't know exactly how it is here at NECA, but if you call the state, it's always a different person.
I think that lifting yourself up by the bootstraps, I mean, is physically impossible. I think it takes both. It's impossible when you're in poverty to just make it happen and suddenly not be in poverty. There's just too many barriers. So yes, you absolutely need to have support in that and need the resources that our state is putting in. But you also need to have that hope and that want to do it. So I think it's definitely something you do with people. And so, yes, I think having all about having enough case managers and having our service providers fully staffed, they can do their work in our communities much more efficiently. And you don't have that, I forget who mentioned it before, kind of that constant turnover. I think it was you, when we're underfunding agencies. People burn out, and that's not good for their coworkers or the people they're working with. So I really think investing in those supports is something.
I also think that supports are more of a coaching model than
Yeah.
a case management model. I think it really is more like coaching or peer support, or that you have a relationship that is consistent over time, supportive of you making progress on your identified goal and having that accountability. And that relational work, but it's a different model than having a case number being case managed.
Sorry, go ahead.
It's just, we've done a lot of work around the whole family approach, which is an approach that allows us to wrap around families and individuals, but specifically when we think about families and specifically under the age of 6, that we have whole family approach coaching where a family can set goals for themselves and that are child-based and family-based, and that they are followed for a long term. And I think something that we struggle with as an agency, as we start to think about what that looks like for us, are the barriers that come from different funding sources and how we have to use them, like FTEs or barriers, whether it be qualifications or age limits, like those sorts of pieces. And so we've done a lot of work as an agency to break down the barriers from the pieces that we can control from within, and thinking about blending and branding our funding to be able to give that resource or that approach to the children and the families in our community. We're at the beginning pieces, but I think along this journey, we will partner with the state and have a lot of conversations around what we need to be able to support that as we move forward.
I also think the relationship and community building stuff goes a lot to the original point you made, Julie, at the very beginning about hope and despair. And definitely thinking of the clients I've worked with at Legal Aid and people who've done hard things, like it's often because of a relationship with somebody who encouraged them, like my doctor, I really respect my doctor, they really want me to go to drug treatment, I really don't wanna go, but they really want me to go, I think I'm gonna go, you know, like, but that's because they have a relationship with somebody that goes for a long time, and that getting rejected for apartments or jobs or benefits or losing in court can be just so demoralizing and and humiliating even. It feels like a personal assault. So having someone who believes in you, like, no, you're a valued person, like here's, you know, really does help. I mean, I think the money is the big thing, like money, it's not just relationship, but I think it goes to your original point about hope, but it requires this consistent relationship with someone who actually like cares about your goals and
relationships can help with generating peace when there's community wealth, right? So like if in a community where people aren't experiencing poverty and there's a big event like a fire or something like that, right? People have either inherited wealth or community GoFundMes or different ways to kind of get through those emergencies. But I find that if there's a community experience in poverty, it can be much more challenging to build in our resources. And I think we often talk about like people transitioning out to take care too, and if they're transitioning without a community or relationships or permanency, then they really do often feel like they're completely on their own. So in terms of what can work, there's some really innovative programs out there to try to help one match people with relationships, but then also like create opportunities to build real wealth that can kind of break through that barrier of poverty. They cost money, but they really do seem to be effective.
We need to figure out how to quantify that return on investment, because I know it's there, it's just so hard to capture all of the future costs when we don't invest in our neighbors now. And I think we see that in a lot of ways, and they're all a lot more expensive than just doing it now.
Yeah,
Thank you so much for joining us.
thanks for making it available.
Yeah. And go to our page if you want to connect after and get our contact information. It's good to see you. Any thoughts? Anyone from Zoom?
I was just going to say that during COVID, when families were getting money put in their in their accounts, and the child tax credit was increased. I mean, we lifted 40% of children out of poverty during COVID because of that money that was coming in to families. I don't think we're going to have that funding again, but that was very powerful to me, to see that it can happen. And maybe it's just a reallocation of resources, or, prioritizing, that this is such a good investment. So, I mean, I certainly will be looking at, what the priorities are and what we're spending money on. And kind of champion, especially the earned child income benefit, the child income benefit. That seems a very powerful way of getting kids out of poverty. I also think increasing the minimum wage, to $17 an hour would be helpful as well.
Let's chat later.
Yeah.
Okay, anyone else? Because that's also a good segue into the next question, very similar. But from your experience, what does not work well, and could be improved? I think, you talked a little bit, set the stage for us there, that we don't have that federal funding right now. So, what are we spending money on in Vermont that needs to be improved or changed, or should we be directing those funds elsewhere? Have any thoughts? Yeah.
I think criminalization of poverty and how much we spend on prisons in Vermont, I think we're spending, if I read the budget right, upwards like it's $200 million a year just on prisons in Vermont, which is enough to solve the housing crisis over just 4 or 5 years. And then just kind of the criminalization approach to poverty in general of like, salarying people with fines and fees that push them further into cycles of poverty, the fact that we are giving people criminal records and make it harder to get housing and employment. And then, kind of particularly like in the response to grants passed around kind of almost anti-criminalization ordinances, the ability of like localities to like go down that route, which they don't really have authority to do, but that also creates like the opportunity for like broad sweeps where people lose their identification, and then, it's going to push them further out, away from people who they have relationships with that are trying to move them into like the system, the response system that we have. So I think kind of all around, it's just like the worst possible thing we could be doing. We're wasting.
Other things,
please. The first one, that's it.
well, I talked about this, but just the paperwork, really, we need to, I think our IT systems, they're not working well, they could be improved, they don't work together, and I think HMIS, obviously, have a lot of work, but we have a whole framework where we could be tracking a lot more data, and possibly integrating it, we could be using it for more, there's a lot of possibilities. But right now we have like each department and agency has its own system and they don't communicate and they're very old. And so, things get lost or they don't work, and it's always the person who is living in poverty's fault, whether even when they did everything they were supposed to do. So, yeah, our state IT systems need a lot of upgrading, and then we also just need more coordination.
I don't wanna lose your point around like who has the ability to make mistakes, right? And who gets held accountable for things, but also to the IT point, we're losing so much federal funding by not having our structured work, and so that could really help.
We're losing federal funding because our IT systems don't work.
So we, just specific to the DCF, have done, our current CWIS backup system for, not drawing down the federal 480 matches. And there, I don't have a number in front of me, but there is some estimates of like how much we're losing, and it's significant.
Didn't you guys get a grant from them to completely replace the system?
So I work for Voices for Vermont's Children, so I
Oh,
don't
okay.
work for the state. But there is the money that comes from the legislature, I think and there is a federal match for that. And so I believe it's up to, is it $10 million that we have right now, but it's not enough to.
Yeah, the total cost to do this, from my understanding, is a lot, so we're making little, very small shuffles towards that, but I think it's something, that we need to, we really need to be going at a faster pace. It is very expensive, which is a huge barrier. Balancing how we spend our state money can be really hard.
Billy, on your point around kind of systems, I mean, like coordinated entry, I feel like we have a good system, but it only works if you have housing and you have services. So
Yeah.
we have a system, but we don't have the solutions that'll make the system function. And then kind of the one-time issue in the GA program, that's kind of gone all over the place over the years. Not having kind of continuity folks.
Yeah, we don't actually have the continuum of care, like the different parts of, when you think of a continuum of care, that includes that, we have we have the coordinated entry, but we have places to, for people to move it within the continuum. So the framework is there, we just really need the other parts of the continuum.
And I think similarly, sometimes we'll spend a lot of money on addressing a problem at the end and noticing that we do have a lot of prevention programs that do really work really well, or intervention programs that work really well, and continue to remember to invest in the prevention efforts because they do work, instead of spending even more money on the end product. Trying to
The emergency solutions.
Yes.
Yeah,
yes, that, yes, we need, again, on the continuum of care, we might need some of those, but if we're investing more on the front end. Which I know it's hard to do.
I also think it's really essential that people with these lived experiences are always at the table. That they're brought in as witnesses, or they're brought in to provide testimony. I think that should almost be mandatory, whenever we're having these conversations or these discussions, that people with this lived experience, of poverty and what the reality is like for them in terms of trying to navigate the systems and trying to balance their lives. I think that's extremely important for, legislators to kind of be aware of. Because I think sometimes we think of these solutions that aren't going to work, because we're not hearing from the people that truly have the answers.
Where we need improvement is really paying people for that lived experience they're providing. We have our task force and our councils, and we have our, one or two people with lived experience, and then they get a $50 per diem, which often means they have to take a day off of work and still pay for childcare, and come and do this really important work, for $50, which is really just not something we should be asking of people who are often already struggling. So I'm just gonna add and pay them fairly to that Sarita in my notes.
Probably increase that stipend.
Yes. And there is actually a lot of cool work. I think it's gonna be released in the next year. The National kind of Legal Scholars Association, I believe it is, has been doing state by state rundowns of per diems and stipends and things like that, and where, you know, how they tie in with state law and state programs, what changes could be made to you know, like little changes to state law, so that we can really be paying people for their time, but also making sure they don't face a disruption in something like their housing voucher or benefits for these kind of less regular and really important things. So that is, I've seen parts of it, but it's not finalized, and that I believe is cut in the coming months. I think they're hoping to do it this spring, but it might not be till fall. So I'm looking forward to that, because that is something we've been talking a lot about in the youth homelessness sphere. Seth or Karen, do you have any ideas?
I think building off the idea of when you treat the late stage symptom and you have to triage that ends up being the most expensive way, because at that point you're usually dealing with multiple challenges that are meeting ahead at the same point. And I think that's one of the difficulties in this conversation is always the acute short-term intervention versus long-term systemic change. And so I think about, you know, the difference between building housing and trying to find emergency housing. And although those are very similar, if you want to build more housing, you have to invest in infrastructure. And that is a long-term solution that may not have the immediate benefit that we saw from an influx of cash during COVID, right? Where you had those immediate direct intervention, but that is not, as a state, we simply don't have the resources to keep that up at the same capacity. And so it kind of comes down to where can you make the strongest immediate impression while at the same time investing for the future. And so I particularly think that with the long range view of this committee, that direction of conversation is very helpful. And so certainly as we're making those investments in infrastructure for the long-term housing development, that to me, whether it's healthcare or it's transportation, et cetera, I hope that doesn't come across as dispassionate to trying to have those acute interventions as well. But if we're truly talking about systemic change, all the thread that kind of ties a lot of this together is stability. And the way that you have stability is by producing long-term outcomes and long-term systems that actually work instead of sort of a hodgepodge that you're trying to quilt together, because that becomes ultimately very difficult for the individual end user to also access.
I think Seth said it well. There's always been it's always been about a balance, because you have to take care of the emergency needs, and but you always want to look to the long term, and we do have, you know, some long-term thinking, and whether it's the investment in housing or the financial programs, you know, workforce training, or to get people to a place where they can you know, be self-sufficient. But I think, you know, what you heard tonight about access and disjointed and how hard it is to get the services you need, it seems there needs to be more of a holistic approach, that when you get someone and if it's housing first, that's what they need, and you can provide the other opportunities or the other services to help them maintain their housing, or whatever there needs to be. So I think, you know, tonight's conversation kind of confirmed that you know, we have to look at the long term, but we have to take care of people and meet their needs where we are, but I think that's, you know, that's a big job and it takes a lot of resources. I would hate to lose though the information that we gained during COVID, seeing those programs that did work for the short term, even if it wasn't the short term, and if there's some way to facilitate or put our resources into those you know, whether it's guaranteed income for people or you know, that's probably a bit of a pipe dream, but you know, the things that we should discuss because they worked for the short term, they were costly, but just the fact that you know, how helpful they were to people, and if they could depend on certain things for the long term, we might be better off in addressing the whole poverty situation.
Good. No, I'm putting that down.
I think from the very beginning around advertising and purchasing things kind of is resonating with me a little bit in this conversation of, I think we get stuck in a concept that we can't do both. And I think we probably can do both, right? But it would take a recentering of the way we spend money and what we think of in terms of wealth, and how we prioritize some of the advertising and the consumption pieces of our state. So I kind of want to push back a little bit on the, like, we have to decide between prevention or crisis management and think about, like, if there is a way to bring us out of the state that we're in right now with the resources that we collectively have in the state.
I think really that, I think we do have the resources, we just misspend, but also like we could raise additional resources. I remember seeing Public Assets had this really great presentation, if I remember right, showed that like we have relatively progressive taxation, but when you get to kind of middle income, it becomes regressive towards the highest earners. And there was a really common sense proposal that passed the House last year that would have raised, you know, 75 million a year from the having folks at the top 1% pay their fair share. So I think there's ways we can raise substantial revenue that I think should be front and center of the legislature.
Gonna chime in. Okay, I think we can move on to our final, and you were kind of taking us there. So this is really, you know, we've seen some presentations over the, well, some of us over the past meetings we've had. We've talked a lot, so I really would like to hear from you, especially as we prepare for our final meeting, creating our report. Kind of what thoughts, ideas, questions, solutions, kind of put it all out there. I'd especially really like to hear if you feel or see kind of recommendations coming into mind that we should be thinking about for our report. There's unanswered questions we can try, something more, things you want to hear more about. Either from tonight or prior meetings. Now's the time to just kind of have an open-ended discussion. So, like Amy, I know for you, a lot, you know, you carry around child tax credit and child tax credits and direct cash transfers, really giving people money to use the way they need to. I think sometimes like we have good intentions with our programs, but sometimes people need the money themselves to really be able to truly fix their situation that our programs don't always allow for. I got to hear a lot of cool presentations while I was in Atlanta a couple of weeks ago for the Runaway and Homeless Youth Conference. And even we got to hear from some youth who had been part of programs and really just during and so they were all recipients of direct cash transfers. And it really made it possible for them to be able to like find creative solutions, like going in and getting an apartment with friends that might not really be possible currently with HUD vouchers and things like that. So I think our best intentions can also sometimes serve as barriers. So one of the things and what we've been hearing from me is really thinking about how can we just put more money into people's pockets to make them less free up some of their time, so they don't have to go from this place to this place to this place and really meet the needs of their household and not kind of what our system thinks they need.
I think all of the research on the direct cash transfers have been extremely positive and not unexpected, I think. But when I think about the Advisory Council on Child Poverty and Strengthening Families, I feel like we have a long list of really important things that we can do for both pieces of that. I feel like we mentioned at each of the meetings, but one of the things that didn't bring up tonight yet is our Reach Up program, right? So that's supposed to be like the safety net to catch families while they're trying to get to economic stability. And as we all know, like we fund it at a fraction of what it needs to accomplish its goals. And so if we're using 2001 housing stipend and the 2019 basic needs stipend, and then we're cutting in half with the rate of reduction, we just don't give people the opportunity to do all the other things that we talked about earlier today. And so I think the programs we have need to be fully funded, right? And then we also know that there's lots of ways to remove the barriers to true stability and savings. And most of them, I feel like we've talked about a little bit today. But I'm curious, like as a group, sort of how we go from here into the session, right? So we're gonna have, I imagine, a really comprehensive list of things that each of them would make a significant difference and collectively would take a lot of work to thread together. And so I don't know, I know we have another meeting and there's time to talk about that, but how we, you know, is our goal to have a series of recommendations? Is there possible legislation that could come? Is there an opportunity to reconnect and see sort of how the vision is moving forward? Yeah.
It seems like all of our issues are in that 2019 recommendations report. The issues unfortunately haven't changed too much. Some of them that we've addressed, and you can see with the update that Katie did the first time around, but maybe we ought to, you know, move, you know, take on some of the newer things that we've talked about. But you know, I don't know if we could walk through that and just say, yes, that should be a continuing recommendation to fund this or do this, or and then add the things that are maybe more timely this time around. But as I say, the issues don't change. They're still there, and it was about childcare and housing and economic development programs and childhood trauma and most of it and you know, services and resources, and seems like a good part of it was in those recommendations that we ought to build on and update possibly. And then we might want to consider other groups that are putting forth legislation or something that people are working on, you know, take advantage of what else is out there and the legislation that's being proposed to, you know, either lend our support to it as a council or at least hear from people that might be helpful. I don't know if we can do that all in a meeting, but that sounds like something that might be worthwhile.
I really appreciate that suggestion. I think that feels like you know, a lot of the work has been done and it's kind of like updating, seeing what work's still left to do, less kind of recreating the wheel, because I agree, a lot of them are going to be be the same topics, the issues don't change, but kind of meeting the current moment, they may need some updating or additions. Yeah.
What I was gonna add is what I think really elevated and it isn't captured in the laundry list of what's available, right? It is that approach around coordinated support. And I don't know how other states, like maybe there's a state that gets it differently, that really can wrap families. I think Vermont families either access services through the state, right, or through a community provider, and then there's discrepancy on the approach and who's in charge of what service, and I think like we heard that tonight, we hear it all the time in the field and the families we work with, and I don't think that shows up anywhere. So I don't know if that can be something that a recommendation around service coordination or service approaches, because the whole like there is evidence-based that like whole family approach, where you really wrap around in a 2-gen model, moves families forward. And I know Maine has doubled down on that. I know states that have put some energy into that work.
Yeah, and I think we were both saying like using that as just a framework to get started, but yes, I think there are other components we need to add.
Right.
Do you think you could, in our next meeting, you mentioned those other states?
I know one.
One, okay, or even
I can
like-
just Google it. Connecticut, right, yeah.
It's the
Yep.
whole state has doubled down on whole family.
Can you be able to present a little bit to us on like what the other states are doing that we could possibly, replicate parts or, to draw from, I mean, okay, great.
Because I think the approach ties the things together.
Yeah.
Different.
Wondering, if it'd be possible for the legislature to kind of change the way fiscal notes are drafted. And so like right now, they're kind of narrowly drafted that only look at kind of the cost in kind of a narrow sense of something, but not the true cost or the true benefits of something. And they're like used only certain times. So like they're used on housing bills to say, oh, we can't afford this because look at the fiscal impact. But they'll issue a criminal legal bill that has huge fiscal implications and won't attach a fiscal note to it. But if there'd be a way to like change the methodology of fiscal notes that would like get at these like the cost savings of like things, so like we're investing here, these are the actual benefits that will come. And not just look at it through this narrow like expense only line.
I think that coming in to the legislature after being kind of an advocate for years, that's something I always struggled with, is we look very much at the here and now, like this is how much we have and this is how much this costs and this is what we're gonna do. But I think that's also, despite having all of this money going out, is we've always just kind of kicked the can down the road. It's too expensive, but every time we do that, it gets more expensive. So I agree, we really need to figure out how do we quantify and track, and some places we can, but I feel like the financial experts are probably the one who can develop that method for really tracking what are we, we're spending this money now, but what are we saving down the line?
Or the true cost of spending down the line.
Or
Yeah.
Things you're excited about, you wanna talk about more? I had one and now I forgot what I was gonna say, I'm excited about that.
We haven't spoken about yet tonight, but I think came up in last year's report, or the 2019 report, and the last meeting was sort of figuring out how to be prepared for possible changes in our structure and just a commitment to making sure that we continue to prioritize the needs of kids and families, and compensate for anything that might change from federal funding.
it might be worthwhile to see what's gonna be proposed in the budget. Before we, maybe make recommendations or just so that we can comment on what's not in there and what the need is that's different from what's in there.
Going back to the federal funding, that's one, thinking a lot about and keeps me up at night quite a bit. But I'm like, I don't know, that we just have to be prepared for a lot of possibilities, but I'm wondering if folks have thought about that. And it's especially, we have a really nice broad range of experience here, from different areas. Service providers, in Vermont, I'm just wondering what are you worrying about might happen, and what you see if we can preemptively address them, or be prepared to address them. I think probably a huge part is just knowing, what we need to be watching for.
A better understanding of sort of funding streams and what they fund, right? And then sort of what are federal requirements and what are state requirements and where there's flexibility and not in things, so that we can know sort of what we can change, and then, use flexible funding to make up the differences. I feel like our state does a fairly good job of trying to sort of move things around, and try to draw down federal funds in some places, but if there's shifts in access, then if we can be as creative as possible to draw down the federal funds for those distinct populations, and then make up the difference with our flexible funding, it could be really helpful. And I often wonder that myself with different pieces, particularly on housing, like sort of where all the different requirements come from and what can be changed without losing federal matches and what can't. And I don't always get a clear sense of where the structure comes from. And so, and that happens for many different things, right? But we've been the legislature's done a really good job with the retail policies to make them really match the families. And so wondering like how much we can do that going forward.
I'm also just very curious about AI and how AI can help us save time trying to find viable solutions. And I don't know anything about it, but what I think in the next 5 years, we're going to see ways that we can present a question or a problem, and come back with some, solutions that looks at the broad spectrum of options and resources. So I am curious about how technology will be able to help us, hopefully, prioritize how we do things and what we do, but also just be able to reach out to a much larger pool of information and basically information, and provide viable resources for us that would save us time, and that would save us money. So I'm just curious about that. I don't know, but I'm just getting this inkling that, in the next 5 years, that will be very useful to us to try to find, cut through a lot of things that aren't successful and really pinpoint what is successful, like with other states. You know, just kind of asking like, what are other states doing to address poverty, and you know, how are they raising revenues, and how are they, you know, using federal money, you know, to solve these solutions. So I'm just curious about that, how that's going to impact our ability to serve people in poverty better.
Actually, I'm gonna Google that now and just search.
I just did.
Oh, did you?
Yeah, it's kind of weird. So what I had to, I was like, all right, so it generate, I just said how to reduce child poverty, like, and it says AI overview, income support, so cash transfers. Work, they gave some work suggestions, childcare with affordable, accessible, high quality childcare. Family leave, child tax credit, SNAP, early childhood, so Head Start, early Head Start, and other preschool programs, so it's just. I had to do a little, I had to look.
Interesting.
So
I'm
it's
also
interesting.
wondering, I'm gonna look into like, are there?
I mean, I don't know how
It's
it all
not
works.
something that's totally on my radar. But like, are there ways we could use technology, or AI to break down barriers? I don't know, so but I'll see what I can find. I like that out of the box thinking, Sarita.
Hmm.
You should ask Monique, Representative Priestley. Hey, anyone else? Okay. Well, I want you all to consider, to continue to think about this. I'm gonna be in touch. We're gonna have to do our final meeting like during the legislature, so it'll have to be on a Monday. Sorry, I had an illness and then had a reaction to the illness, so I was not doing well medically for a bit there. But so I'll be in touch about that. But I really like your suggestion, Karen, around using that as the framework. Mike, will you just bump that document again for everyone?
Yep.
I'm gonna type up all my notes, and I know other people were taking notes. Feel free to share your notes as well. There were some folks who couldn't join us tonight who I know care very deeply about this. I'd like them to kind of know what we're thinking about and talking about. And then, yeah, really come prepared, reach out to me if there's something, if you think, oh, I want to hear more about this before the next meeting, let me know while we're building that final agenda, and I can get some people there to speak to any lingering questions. And then I think we'll just kind of go through that framework and talk about new ones and go from there. So thank you all for joining us, making the drive, sitting on and watching us eat. You missed some good spaghetti. I'm sorry you couldn't make it in person, but I appreciate you joining us by Zoom. And yeah, safe travels, everyone.